Hello, everyone. Good afternoon or good morning to you where you are across the world. And thank you so much for joining us today. Thank you so much also for being patient and letting us in. Um, and while we were letting you in, ironically, today of all days is the day that we're having some global challenges in relation to some internet connections and Microsoft. So we really appreciate your time and waiting for us. And we'd like to start this event immediately. Just some house rules in terms of this event. We will be the speakers online. Everyone else's cameras and mics will be muted for the session. However, at the end of our session today, we will have a Q&A session in which we will allow participants to ask us questions and engage with the speakers here today. So thank you so much for joining us, and welcome to the event as hosted by the Women's Legal Center, where we will be discussing the right to public health care for women living in poverty. This is in line with the priority theme for CSW as an online event that the Women's Legal Center is hosting. The priority theme for CSW for 2024, the 68th session, is accelerating the achievement of gender equality and the empowerment of all women and girls by addressing poverty and strengthening institutions and financing with a gender perspective, with a secondary review theme as social protection systems, access to public services, and sustainable infrastructure for gender equality and the empowerment of women and girls. So in light of the above CSW themes, and considering the work of the Women's Legal Center, we are specifically hosting this as an NGO forum event. And what I'll just be doing briefly before we kickstart our event is to introduce our panelists to you today. And the first one that I'm going to introduce to you is Kuliso Managa, who is an attorney at the Women's Legal Center. Kuliso is a human rights attorney and social justice and gender activist with an LLB from the University of Stellenbosch, where she majored in constitutional law, international law, and social activism. She's currently an attorney at the Women's Legal Center and works in the sexual and reproductive health focus area. She advocates for non-coercive, violence-free access to sexual and reproductive health services, recognizing the complexities and challenges women face in making informed healthcare decisions. And she litigates to protect women's rights to reproductive health choices and works to improve accountability in the healthcare system. The second panelist we have today is Mariam Altibi, who works at Democracy and Workers' Rights Center, and she in Palestine, and she is the Communications and M&E Officer. She is an External Relations Officer at the Democracy and Workers' Rights Center with a BA in Journalism and Political Science. She advocates for gender equality and women's empowerment, and Mariam works on promoting gender equality and empowering Palestinian working women, contributing to amendments of the Palestinian labor law to end discrimination. She also focuses on activating ILO Convention number 190, which seeks to eliminate violence and harassment in the workplace. As a member of ESCR Net since 2016, Mariam contributes to developing strategies and is part of the Women and ESCR Working Group. We also have Koli Buthelezi, who is from Sisonke, which is a national movement in South Africa, and she is the national coordinator and a feminist activist since 2002, based within South Africa. As a founding member of Sisonke, she advocates for sex workers' rights in South Africa and internationally. Koli's work focuses on mobilizing and organizing sex workers to claim their rights, including advocating for fair working conditions, decriminalization of adult sex work, and access to health and social services. She is a member of ASWA, NSWP, and serves in various advocacy roles nationally, regionally, and internationally. And then our final speaker for today is Ida LeBlanc, who is from the National Union of Domestic Employees, called NUDE in Trinidad and Tobago. She is the General Secretary of NUDE and President of the Service Worker Center Cooperative. She is also a newly elected executive member for the Caribbean at the International Domestic Workers Federation and a member of the ESCR network. With a background in labor studies, she is passionate about advocating for the the rights of domestic and low-income workers, and she has led successful campaigns for the decriminalization of the Minimum Wages Act and continues to empower workers through training and awareness programs. And this is an introduction to the diversity that our speakers will be presenting to you today in terms of women's rights across the globe who live and work in poverty. Myself, I am Chrissy Blouse. I'm an attorney at the Women's Legal Center, and I will be the facilitator for this session today. I want to just, as we start, set the scene for everyone to understand why we are here today and how we are linking this theme to the work that we do at the Women's Legal Center. At the Women's Legal Center is an African feminist law center which focuses on education and training, strategic litigation, advocacy, and awareness within communities in which we find the women that we work with. Our work is centered around an intersectional feminist lens, which seeks to highlight the various factors that compound and that women live through and compound their vulnerability to violence and discrimination within both the worlds in which they live and work. And the intersecting lens that we are hosting this event in terms of today is the intersection between women's rights to access adequate healthcare services and their rights to work in spaces that are safe and just, and the intersecting forms of discrimination women who live below the poverty lines face when trying to access adequate and basic services. And our participants today will speak through this intersection by speaking to the different elements of their work within their context, but specifically to underpin this context by the lived reality of women within that context. I want to start us off for today and hand over to Ida LeBlanc, who is from Nude, who to please speak to us, Ida, if you may, about the lived reality of domestic workers in Trinidad and Tobago. What are the main issues that domestic workers face when trying to access basic adequate services and access to health? And what are the rights and the state of rights for domestic workers, including their challenges in the context that you are working on right now? Ida, if you can hear me, you can unmute your mic and you can please introduce to us the state of the rights of domestic workers within the context that you are working on, some of the challenges that they are facing, and their rights in relation to access to basic and adequate services. You can go ahead.
All right. Good day. Good day again. Our union, the National Union of Domestic Employees, we have been working since 2 decades and more for the rights of the domestic workers here in Trinidad and Tobago. Our burning issue since we started, and is still a challenge today, is recognition for domestic as workers under the Industrial Relations Act. Because in our country, under the Industrial Relations Act, it states that anybody who works in and around the household and paid by the householder is not a worker. And that is our greatest concern, because when a domestic worker is fired or they want to seek redress in any matter that concerns them between the employer and the worker, we cannot take up the matter unless it has something to do with the minimum wage law or the Maternity Protection Act. These are the things, these are the two legislations that we have been able to win so that domestic workers are included under these two acts. They are also included under the national insurance, because the national insurance deals with wage earners. So their employer has to pay take out money from their salaries to pay for the national insurance, also with a corresponding contribution from the employers themselves to pay to the national insurance. So a lot of domestic workers employers do not pay the national insurance. So in that case, when the worker reaches 60 years, they're not entitled to the pension scheme that they have, right? But besides that, they have 12 other entitlements under that law, right? Because if you are sick, you can get payment through the national insurance. If you are disabled, you could get pay. If you are on maternity leave, you will get. It's a very good scheme. So we are happy that the national insurance domestic workers has been included. So we represent these members in the workplace, in workplace disputes, and facilitates organizing, advocacy, as well as training and education programs for them and their families. And the aim of ensuring that workers in the country can secure decent work and an improved quality of life. We have been seeking recognition for these domestic workers, as I said, but we were unable to get government to budge on the issue of recognition for domestic workers. So we have lobbied the CEDAW committee and got them to make a recommendation to our government stating that government must amend the Industrial Relations Act to include domestic workers as workers. But that in itself, we haven't got anything successful within that. So the act states that anyone who works in and around the house and paid by the householder is not a worker. So if you are a gardener, a chauffeur, even a security guard, because according to the status of the employer, these is the workers that they will have working around the house. You are not considered a worker. So you cannot bring any case as a dismissal to the industrial court unless you have a company and you had hired the worker under using the company's name. So that is the way we get to go and represent some of the domestic workers in the industrial court. So domestic workers in Trinidad and Tobago face various challenges that impact their quality of life and well-being. These challenges include low wages, long working hours, lack of job security, limited access to benefits, and they often experience discrimination and exploitation. Most of them, their salaries are unable to take care of themselves and their families, with a high cost of living, with rental of a place to live and food to put on the table for their family. Usually takes up most of their wages, with little or nothing for their children to travel to school. But they can seek free transportation by riding free on the government bus. There is also free health care for all, but the length of time to wait for follow-up visits is not encouraging. Public assistance grant is for most individuals 18 years and over who are unable to work and who are certified by a government medical officer as unable to earn a living due to physical or mental disability. Or if you have a disabled child and unable to work, or if your husband is in jail. The board also has its own guidelines as to a child who could be deemed needy. Public assistance, in my view, should be given to all women who provide unpaid work in the home and those who work for the minimum wage, which cannot go far with having to take care of daily needs of their children. Social security benefits are often inaccessible to domestic workers, leaving them vulnerable in times of need, even though the government has implemented several social protection programs to support vulnerable groups. These programs aim to provide financial assistance, healthcare, and food to those who need it most, but it is not without its deficiencies. Domestic workers encounter obstacles in accessing fair wages for the ton load of work they have to perform in some instances. decent working conditions, and limited social protections and legal rights. They are often marginalized and face difficulties in asserting their rights due to the informal nature of their work. Accessing fair wages is a significant challenge for domestic workers due to the lack of rigorous labor inspectors in the sector. Because most domestic workers are not considered workers, they have limited legal protection, which makes it difficult for domestic workers to address issues like unfair dismissal or workplace abuse and health and safety issues at the workplace. Our concerns are that the Social Security program does not target the most vulnerable groups effectively, which means that some people who need assistance may not be receiving it. The program may be stigmatized, which can discourage eligible individuals from applying for benefits. This can limit the effectiveness of the programs in reaching those who need it the most. Some individuals may face administrative barriers when trying to access social protection programs, such as difficulty in completing the application forms, lack of knowledge about the application process, or long waiting times for processing applications. So the National Union of Domestic Employees plays a crucial role in advocating for the rights of domestic workers in Trinidad and Tobago. NUD works towards building the capacity of the union by seeking to recruit more members. More members will make a stronger union in advocating for rights and protection. Improving working conditions, providing fair wages, providing legal support, raising awareness about domestic workers' rights, training them to be computer literate, and empowering them to assert their rights effectively. Working together with other agencies to ensure this work continues, especially our work with the National Training Agency in our country, who is assisting NUD to open and operate a workforce assessment center to certify domestic workers and train these domestic workers to be assessors at the school. The organization offers legal assistance to domestic workers facing issues at work and conducts awareness-raising campaigns to educate domestic workers about their rights and empower them to demand fair treatment. These ongoing activities are supported by the Ministry of Labor through the Labor Inspectors Division, the National Insurance Division, and the ILO Caribbean Desk, because the National Insurance comes to our meeting and to tell workers about their rights and entitlements on the law and encourage them to find a way to encourage their employers to pay the national insurance. Through our efforts, NUD aims to create a more equitable environment for domestic workers in Trinidad and Tobago. With this continuous training and education for the upliftment of domestic workers and their family members in accordance with our mission statement. NUD recognizes the importance of access to healthcare and social services for domestic workers, especially in light of the deficiencies in existing social protection programs. And this will be assisted by the International Domestic Workers Federation to ensure that we can do this program. By advocating for improved access to healthcare and addressing barriers to social services, NUD contributes to the overall well-being and quality of life of domestic workers. Therefore, NUD plays a pivotal role in empowering domestic workers, promoting policy reform, and addressing inequality in Trinidad and Tobago through collective action and solidarity. NUD continues to be a driving force for positive change in the lives of domestic workers at the national level, regional, and international level. In summary, NUD's commitment to advancing the rights and protection of domestic workers is exemplified through its advocacy for the ratification and implementation of the C-189. By aligning its objective with the principles of the convention, NUD plays a pivotal role in empowering domestic workers, promoting policy reform, and addressing inequality in Trinidad and Tobago through collective action and solidarity, Nude continues to be a driving force for positive change in the lives of domestic workers. And in concluding, we call on the United Nations agencies and all those women in power to align themselves and connect with poor persons like ourselves, poor women, so that we can bridge the gap between rich and poor, academics and non-academics, and really show us women down below that those in power really care about us. And let us work together to make a better world for all of us. I rest my case. Thank you very much.
Thank you so much, Ida, for that presentation. I was really inspired by the work that you have explained that Nude is doing, and I think everyone is. Welcome to people who have joined us in the last 15 minutes. We are having our CSW event, which speaks to the vulnerabilities of women who live and work in precarious conditions and their access to basic health and social security services. And we just heard from Ida LeBlanc from Nude, who is based in Trinidad and Tobago and who works on the rights of domestic workers. Thank you so much, Ida, for the presentation. I think three things that really stood out to me about what you were speaking about is one, how we need a multi-pronged approach when we want to speak to issues that relate to women's rights to access to basic services, in particular health services. And you spoke how Nude works with legal advocacy and education and awareness tools. At the Women's Legal Center, this is something we deeply embed within the way in which we work too, strongly collaborating with organizations. And I think and hope that towards the end of this, we could speak to some of that collaborative ideas and solutions and mechanisms we can use throughout the world between our countries and to collaborate and support each other in this work. I'd also like to pick up a lot of similarities in relation to the rights and states of domestic workers within your context, because we see the same context through our work at the Women's Legal Center in South Africa. Until recently, so domestic workers were specifically excluded from social protections in our law, and we saw this as a systemic form of discrimination in which even the law recognized women's work and continued to deem domestic work as undervalued and underpaid. And we know that where the stigma and stereotypes persist in certain categories of work within South Africa, so too the discrimination and the vulnerability compounds. And specifically, this group of women are facing difficulties in relation to all aspects of their life, both within the home and within their working space. And until recently, domestic workers have now been included within these social protections. However, like you said, even when there is provision within our law for it, it is about how tangible, how much can I actually access that law? Because the law, when on paper in a formal sense, really means nothing if it's not going to substantively change for women in our communities, women within these workspaces, and if women are really not able to access the law. And I think that comparison and the similarity runs deep because it shows how systemically across the world domestic work is viewed, both within our legal system and within our society and within our communities, and the historical context around domestic work that lives deep even until today. So we look at these similarities and we look at how you also mentioned that the work really needs to be informed by the lived reality of women, because it's no use we also have systems in place, but it actually doesn't catch and is not accessible to women. And so I want to shift us a little bit into a conversation around where women work and live in precarious conditions and struggle to access basic services. But I want us maybe to shift and look at it through a different lens, because what we just saw now as a domestic work sector in Trinidad and Tobago, through the work that Nude is doing, we see that domestic workers are still not recognized as workers. However, within a South African context, domestic workers are recognized as workers and have access to the social security and have certain laws and provisions that seek to regulate the domestic work sector. However, they still struggle to access basic services to health, access basic services like social security services. And so I want us to switch now, and I want to hand over and bring up Siskoli. You can turn on your video, please, and unmute yourself, because I think what would be interesting to hear from Siskoli in relation to the sex work community is if in our systems, we and our law, we have provision for domestic workers, and they still struggle to access basic services. How much more challenging is it for women where the work is actually in a state of criminalization and what that looks like? And so, Siskoli, I welcome you to please turn on your video, turn on your mic, and just speak to us a little bit about what the state of sex work in South Africa at the moment. What is the state of sex work in South Africa? And how does the state of sex work in South Africa affect sex workers' ability to access rights, right? We know that there are certain groups of work which are vulnerable due to the nature of the work, but so much more so for sex workers in South Africa because of the criminalization. And it would be interesting to hear from you, how does the criminalization affect the rights of sex workers to access health and to access basic services? Do they even have an opportunity to access social security or any other basic services? And further to that, how does the criminalization impact Sisonke's work to provide support to sex workers? Thank you so much.
Thank you so much, Chrissy, for the opportunity. My network is on and off, so if you notice it kicked me out at first. I don't even see myself on the video. I think you do see me. So then what I was wanting to ask, if it's possible, because I've already waved to everyone, and thank you for joining our panel. You can see this is
We hear
Coley.
and see you well, Siskoli.
Okay, all right. So thank you so much for the opportunity to take part in this webinar. Sisonke is the founded a sex worker movement. It was 2003 in the Western Cape by women to protect the rights of sex workers in South Africa. So we at stand that is Sisonke is only the movement in the country founded by 70 women in sort to protect the sex workers' rights, policy brutality, and also harassment in improving the sex workers' access and equality to healthy care, also spearheading the decriminalization of sex work in the country, because currently in South Africa, sex work is totally criminalized. So the sex work trade, it's a trade that is dominated by Black women, a majority, and also it's criminalized under the sexual offense in the Act of 1957 and Act of 1957, previously the Immorality Act, I would say. So both service provider and the buyer are being criminalized. And the criminalization access to justice, it's a big barrier on its own. So what we then as an organization did, we decided to register the organization so that we can be able to source funds. As Usisonga was registered in 2017 as a non-profit organization with the Department of Social Development in 2017. Today, Usisonga as a staff of component of 33 individuals, majority from the sex work trade, with more than 600 members on our database who are self-identified sex workers, sex work, identified as sex work. Our peer educator also at the first point of reference in linkages to care to our members. The human rights in sex work. Now, the criminalization of sex work as human rights is a violation on its own, and at the same time, it is a driver of stigma and discrimination. So as an organization, sex work is just to lay foundation. Sex work is an agreement between two consulting 18-year-old and that exchange sexual services for financial gain. And in South Africa, this trade is dominated by Black women, are often perceived and as uneducated and poor, with no options to the trade as sex workers. As sex workers, often sex workers also dubbed disease and carriers. That's how people perceive and in their perspective, see us as sex workers. Well, this is a phenomenon that we should shy away from, and the sex work trade is a segment that adult entertainment that it is most stigmatized and marginalized amongst the communities. And then this trade is this far criminalized under the sexual offense of 1957. Previously, the Immorality Act notion resulting that from the apartheid regime of 2000 and 2007. the Sexual Offence Act was amended to criminalize both the buyer and the seller of sex work. So both the service provider and the buyer are this far criminalized under this sexual offense. And the criminalization of sex work has always been the hindrance to access justice, healthy care that is free from stigma and discrimination, pushing our members into substances abuse and as a coping method. So under the human rights of sex work, in a sense, the criminalization of sex work is a human rights violation, as I said earlier on, that the South African government failed to address as per country constitution, because we have this beautiful constitution in the country, but that does not accommodate or in the implementation of it, it's something different, which is a very big concern to us and the citizen of South Africa. So South Africa is also a secular state, promotes the rights to choose, freedom association, economic freedom, and the right to equal health care, free from stigma and discrimination. For decades, the appetite to address this human rights violation has been a key driver of the stigma and discrimination. Also, to address their human rights violations, where we have been calling for decriminalizations for more than 28, I think now it's more than 25 years, with the support of Sex Worker Education and Advocacy Task Force. Now we are part of the ASIGIGI Coalition, which comprises of the individuals, advocates, and the human rights and activists. If not mistaken, now it's plus minus 170 something members on that. And then the challenges that we are facing with the sex trade range primarily from the marginalization to substance abuse, harassment, and beyond. Among other challenges are the criminalization of sex work and limited resources, particularly the finance to reach all sex workers. Funding is often donor funds which come with restrictions and also admin heavy informed the research. Sometimes it conflates with our intentions, which is to seek resources of human rights violations and law reform. We came from a time where the police officials are sometimes confiscating condoms, ban the condoms from the sex workers, further interrupt to efforts the cap of the HIV spread. Because I mean the condoms are safer sex practice tools. So if then police are kind of like destroying them in this situation, we also expect our government to do an intervention around addressing that, because one part of government is giving these condoms to us and not because we are sex workers. Every citizen has every right to have the safer sex practice in order to prevent HIV. But what surprisingly is that only sex workers are being arrested when carrying condom, or where they hid their condoms have been taken away and have been banned. So I sometimes ask myself, that is that kind of the hatred from the subs that are supposed to be protecting us in South Africa in a way that they would do such. So that means that we need to be infected by the HIV. Now, the big challenge lies in the sexual and the physical violence perpetrated against the sex workers, including the high stigma index. I would put a couple of solutions, I think, forward. As a movement, our stance is to address these issues by strengthening our advocacy strategy to reintegrate the sex workers into civil society. Sisonge is also taking strides into exploring advocacy efforts through the social media platforms. And these efforts have yielded a wider reach of sex workers and non-sex workers to build the strengthening of our allies. We're also forging these relations to create a referral system complements our efforts. Although we have not reached the pinnacle of our advocacy strategy, which entails achieving the decriminalization of sex work in South Africa. And we continue to align with organizations such as Women's Legal Center today, is hosting this beautiful webinar and making sure that the voice of sex workers is amplified and heard in the higher platform, where we also seek support in the challenges that we are facing. Legal related matters about women as any of many. And that is a best practice that I think Women's Legal Center has done in working and supporting sex workers issues, not because they are sex workers, but issues that because sex workers are women. On behalf of Usisonke, I would like to invite minded organizations to explore with us from a woman's perspective the protection of women's rights and the acceleration and prioritization of access to equal health care for women as women, let us unite and address injustice that it is destabilize us. Thank you so much.
Thank you so much for that, Siskoli.
I thought I'm
Thank you for your
disconnected.
presentation.
Sure.
No, we are here with you. Thank you very much. We've been following you. Thank you
Okay.
so much for your presentation. Um, I think once again we are able to see that even where we are in different contexts, the similarity of vulnerable women across the globe. I think the highlights from your presentation is how women remain the face of discrimination generally within South Africa. But I think importantly, like you had indicated, that face of discrimination is particularly Black women within a South African context. And there is a history around that. There is a specific historical context around that. And then in relation to sex work, like you highlighted, there's a historical context in the way that we view women's bodies, and that the way in which we view what women should do with their bodies, and particularly Black women. And I think the stigma and discrimination, I think what we highlight from your presentation is how there's this conflict. I think your presentation highlights to us about how there are state actors who should be prioritizing the development and the growth and the acceleration of women. But you actually have within the sector of work state actors further harming women. So here we've taken the conversation, I think, a step further, where it's now not just about are women able to access the services, but actually you have a cycle because of the sector of work where you have state actors like police harming women within the sex work sector, removing their condoms, increasing their risk to HIV and other health factors. And then you have that very same woman experiencing discrimination when trying to access health or basic services. And it's a continuous cycle of, I think, like what is a clear thread from Ida's presentation to yourself is this realization that there should be these rights, but instead the state is the actor of human rights violations itself. And I think that is the theme that comes so strongly from your presentation. We thank you so much for that. And I think what you do is lead us so nicely into a conversation that we can have with Mariam now, who can introduce to us kind of, because we've been dealing with these conditions of women living and working in precarious conditions. And through Ida's presentation, we've discussed the sector of domestic work, which is particularly vulnerable because of not being seen as workers, and then the sex work sector, which is essentially criminalized and then is harmed by even state actors. So now we've even moved away from accessing services to their harm. And I wonder, Mariam, if you could speak to what the reality are for women who live and work in precarious conditions, who live below the poverty line, but what this looks like, particularly for women as a whole in a country of conflict, because I think that just adds an additional layer that takes us even outside of rights, a state of a constitution or a bill of rights. And Mariam, before I just open for you to take us through that, I would also just like to say to everyone that I know we've been going through a lot, and there's a lot of burning issues that have been coming up just from the two presentations. So please do feel free to send any questions you may have, thoughts, comments, inputs. Please do share it in the chat box. Siskoli spoke about collaboration and how we can use even social media to really elevate and highlight issues. You know, if you want to share your organizational details in the chat box that we can share amongst ourselves. If you have burning questions for us, there's a Q&A option within the platform as well. Please share questions that you may have or any comments. And so, Mariam, I hand over to you now to please take us through the presentation and the idea of what human rights violations look like in terms of women living and working in precarious conditions in a state of conflict.
Hello, everyone. First of all, I would like to thank you for having me. And I would like to start my presentation with paying tributes to all the 31,727 women, children, and men who we have lost since Israel declared war in Gaza on the 7th of October. This is not the first war, but it is the most crucial war declared on Gaza since the blockage that took place 16 years ago. I would like to give you a general view about the context of occupation and how does it affect the health sector. In general, Palestine has been living under occupation for the past 76 years, recording the longest occupation in modern history. This affected all aspects of life and played a major role in delaying any form of development in Palestine, especially that Israel limits Palestinians' access to resources. Israel also continues to extensively allocate resources for settlements, causing a decline in agriculture and manufacturing sectors, shrinking productivity bases, leading Palestinians to depend on labor in Israel, and Israel also controls customs and taxes revenue. Thus, the Palestinian economy depends on the Israelis' economy completely. As all other sectors, the health sector's development in Palestine faces barriers imposed by the occupation and is impacted by the weak economy, barriers to access, and aftermath of continuous conflicts. There is a lack of universal health insurance in Palestine, thus, access to health care is not guaranteed for everyone. There is a governmental insurance policy that everyone can purchase and anyone can purchase, but it is provided and is also provided to registered poor people for free. But the quality of the health care provided is not always guaranteed, not forgetting to mention the long periods of time to wait for an appointment, surgery, etc. More advanced care often requires referrals to private hospitals or hospitals in Jerusalem and Israel or even abroad. But this also needs special procedures and improvements from the Israeli side. There is also a huge challenge when it comes to maternal health care, especially for women. As an example, to make things more clear, in many cases, women who have complications during pregnancy or when giving birth suffer to cover healthcare costs when being transferred to private hospitals for specialized care for them and their children. Sometimes their infants would need to stay in incubators, and such service is provided in a better way at private hospitals. Incubators may not be available also at governmental hospitals due to the high number of patients. Costs for such care are very high and may reach $300 per night for an infant to stay at an incubator at a private hospital. So, for example, if a baby is an early born and was born during the 8th month of pregnancy, the cost of staying at an incubator for a whole month would reach approximately $10,000, and no one can bear this. Since 40% of Palestinian women are unemployed, and even those who work are not necessarily wage employees at a workplace, most women are highly dependent on men's provision of healthcare policy. But if a woman is employed at the private sector and the employer does provide a healthcare coverage through private insurance companies, which is also not a right guaranteed by the labor law for these women workers, she would have to pay in advance for all the treatment and then demand the insurance company to pay her back. And now, to make the context more realistic and what we're facing nowadays, Gaza is completely isolated from the West Bank. Thus, the situation there is even more critical. The health system capacity is very limited on normal days, but after the 7th of October, the healthcare system collapsed even more. According to UN OCHA's data, currently only 24% of primary healthcare facilities are functioning. 12 hospitals out of 32 are partially functioning. 155 health facilities and 126 ambulances have been totally damaged. These facilities clearly cannot support the basic needs of Palestinians living in Gaza, especially during the war. With the restriction imposed by Israel on borders and the very limited humanitarian resources entering Gaza, women and girls are experiencing shortages of essential resources, including medical supplies. Women and girls have historically been greater casualties in situations of conflict, apartheid, and genocide. Health complications are rising in Gaza due to the lack of clean water, as the use of dirty water had a significant impact on women's hygiene practices and increased the risk of having infections and other health complications. The continuous attacks on the health sector forced pregnant women to give birth in overcrowded and instantly conditions without proper medication assistance in many cases. Currently, we have 155,000 women in Gaza who are pregnant or breastfeeding, and we expect 5,500 to deliver within the next month. According to the World Health Organization, 15% of these pregnant women are likely to experience pregnancy or birth-related complications and would definitely need medical care. And due to the huge destruction and non-functioning of healthcare facilities, some women are having to give birth in shelters, in their homes, in the streets, among the rebels, and or in sorry, or in overwhelmed healthcare facilities where sanitation is really bad. Many women had to give birth through C-sections without anesthesia nor proper medical treatment. Local media also talked about women who had complications while giving birth and had to go through hysterectomy due to lack of proper medical treatments. Women and girls have no access to sanitation products, and many are forced to use tense cramps during their periods. Many are also missing their periods completely due to stress. And now we believe that it is really essential to address women's health needs in Palestine as Palestine requires a comprehensive approach that considers the social cultural context, access to healthcare services, and the impact of conflict on healthcare delivery. It is really essential to put an end to this occupation, to restore Palestinians' rights and improve their living conditions and achieve suitable development goals. Wide and global initiative focusing on healthcare access to Palestinians, in particular women, is crucial for improving women's well-being in Palestine. And at last, we believe that urgent international action is crucial to raise awareness, advocate for civilians affected by occupation, and ensure access to medical care for women in Gaza. A ceasefire is demanded right now to keep Palestinian people from losing their lives and losing all their rights. Thank you.
Thank you so much, Mariam, for giving us your lived reality and context within basically an idea of how there were these limited points of access to healthcare and basic services even before the state of conflict, and how there were many issues and barriers. But now, since the conflict, how that has been compounded, how specifically women's vulnerability and their rights to access health has been compounded since then, and how this compounded state of conflict has resulted in damaged facilities and lack of specific access to women. So we thank you so much for that presentation. I think the thing I would like to just take out from your ending of your presentation now, where you spoke to the need for a comprehensive approach, and that comprehensive approach specifically to consider social and cultural context and norms, specifically for that approach to help to end the occupation. But more specifically, I think this comprehensive approach to really look at the lived realities of women due to their social, cultural, religious norms, because I think that speaks to this intersectional lens that we need to have when we look at the state of human rights within all of our contexts, and particularly within a conflicted context. I think this intersectional lens specifically highlights how women are vulnerable due to different factors such as their identity, their race, their cultural and religious background, and societies in which they live, work, and come from, their nationality, their migrant status, and all their sexual orientation and gender identity. I think that all of these characteristics make up the identities of women, and so no one woman is the same, and no one intervention will work for every specific context or state. And so I think I hold on to your call for a comprehensive approach that will not only aid in ending the occupation, but the state of women within Palestine at the moment, and will be able to bring relief assistance and a comprehensive aid to the women and their needs. I want us to continue on this thread of access to health and health discrimination. And there is, like I mentioned at the outset, this intersectional link between where women are placed and their access to health. And through all three of our presentations now, we've seen how where you work and where you live directly determine the state of access you have to basic services, to social security, but to healthcare. As women, we understand that where that access to healthcare is restricted, it affects women in multiple ways. And I want to call on Kuliso, an attorney at the Women's Legal Center now, to identify some of the issues for us within the healthcare systems that continue to exist in South Africa, in the work that she has found that continue to victimize women, and to speak to us about why it has not been an affirming and supportive space for the women in South Africa, specifically for those women who most need these services. Yet the theme that we have found throughout all of our presentation is that the women, it is clear through the work of all of our organizations, that the women who most are in need of these basic services, to social security, to state services, to healthcare, seem to be the women who are the most held back by its dysfunction within their context. And Kuliso, I invite you to speak to us around why this has not been an affirming and supportive right and space for women who most need it.
Thanks so much, Chrissy. And thank you so much to the rest of the panelists really for sharing their experiences and sharing their stories. It really brings a great contrast to kind of our own realities, and a really great contrast to kind of figuring out in the ways in which we deal with problems and with issues. And I think it's really great for us to be kind of having this multi-dimensional conversation. On the issue really of healthcare, really, I think it's greatly been identified by our last panelists about how positionality is very essential to your experiences of accessing healthcare, and how much healthcare has an impact also on um, what the rest of your reality looks like. In the South African context, for instance, we know that we have a very severely underfunded healthcare system where we do not have enough facilities. We do not have enough facilities in rural areas. A lot of our facilities are understaffed, underfinanced, under-resourced, and that has implication on the women that they seek to provide care to. So, for instance, in the context of domestic workers and sex workers who are on the everyday going to their local clinics to seek services, in the context of sex workers seeking contraceptives, our facilities across the board are really broadly having issues with contraceptive access and with termination to services access, services that are really key for sex workers, where if police and SAPS are busy kind of clamping down on tools that they use to create a safe environment for their work, these healthcare institutions then become even more important spaces to be creating and providing those services. And across the board, we've been seeing that women don't have access to contraceptives, don't have access to the type of contraceptives that they want, and really are experiencing a very great kind of crisis when it comes to contraceptive access, which then leads to an additional issue, which is then unwanted pregnancies. This was something that came up a lot during COVID in South Africa, where because our reproductive services were shut down as not a priority. And I can imagine in crisis areas like in Palestine right now, where reproductive services might not be held as priority services as well, you'll have the result of a lot of women ending up with unwanted pregnancies. And then additionally, seeking termination services, which are also drastically underfunded, very difficult to access, and even worse to access if you are in precarious situations, if you're a sex worker, if you are deemed to be a person not worthy of services, for instance, migrants or people who are undocumented. These are all additional layers that color the way you experience healthcare access. We also see that when you even enter these services, there's a lot of stigma and discrimination, which really creates a further barrier to, after you've entered the door and you've started seeking these services, now you're faced by healthcare workers who might not be excited to provide you the services, could be an obstruction, could be, for instance, perhaps even a challenge to you. They might be reporting sex workers to SAPS. They might be the ones who are actually not providing services to them because they have these preconceived ideas that termination shouldn't be used as contraceptives. All of these things that become a barrier and a hindrance to women, where the space and the healthcare space is supposed to be affirming, and it's supposed to be a space that holds women and protects women, because of the population in the world, women and children are the ones who seek access to healthcare the most. And if it's the one thing that's also preventing them from living lives to the fullest, it also then becomes a big barrier to them achieving all these other goals that they seek to achieve in other areas in their lives. If you're a domestic worker, for instance, and you are seeking services, you have to contend with the idea that you have to take off a full day of work, a full day of paid work, to go stand in a queue for hours. And after standing in the queue for hours, you might find that actually today is not your day. They don't have that service. You have to travel 3 more hours to the next facility, or the person you were looking for has retired, or all of these other things. I think one of the interesting things that Ida also brought up in her context would be that it would be really great if our healthcare system specifically also realized that there are also other vulnerabilities that women deal with. For instance, where if they have special needs caretakers at home, if they're responsible for a special needs child or a special needs adult, or taking care of elder persons, they may not have the luxury to be able to travel to other facilities. And so those particular vulnerabilities need to be something that are accounted for by facilities and healthcare workers in specific areas, because the reality is also that women are also in charge of and take care of more people than their own. And so maybe that woman also doesn't have the luxury to leave her child at home by herself. And so all of these things that really in a more privileged position wouldn't be that big of an issue become that more of a challenge and that more of a burden when you are in specific situations, you are in precarious conditions or have a precarious job, which is why healthcare really needs to take a step back and recognize the women that they seek to provide care to, where those women come from and what they actually need from their healthcare services. And only by doing that and kind of having that exercise can those services really take strides towards assisting them in getting to where they need to be. Because if we're having sex workers that are having experiences with discriminatory staff, discriminatory SABs, who can't have access to termination services, this is a very unhealthy cycle that's being created in the system that we need to really take a further look at instead of dealing with at piecemeal approaches. Yeah, I think that answered your question, Chrissy, I hope. So I'm just going to hand over back to you.
Thanks, Kuliso. I think you've really taken us full circle with your presentation. I think like you said, this is really multidimensional. And as you were speaking through, you spoke to the South African context and how our health services are understaffed and under-resourced. But I think we see that throughout many state facilities in which women try to access. And what I think your presentation brings us to is this full circle from Ida through Kali through Mariam, which takes us to how Kali and Ida spoke to discrimination against women because of where they work, and how it's often state actors causing that harm to women and their lack of access. And then how you and Mariam spoke to the increased discrimination and health issues that women face because they are women and because of the services they seek. And so both of you made example to reproductive facilities and the need for reproductive health care and how that doesn't speak to women in so many contexts. But then how the state actors and lack of facilities and resources cause further harm to women. Women sit with a lack of access to whether it's reproductive services, adequate services, basic services. And that just pushes women back into the cycle of poverty, because you then have a context of increased teenage pregnancies, increased health issues for women. And so it pushes us back into the cycle of women living and remaining within that poverty cycle and almost being unable to get out of the poverty cycle through this constant kind of diagram that we are following, and how this leads to just women continuously working and living in precarious and unsafe conditions across the context, across the globe, and across all of our different working spaces. And as we go to our concluding kind of portion of the session, I would really like all of the panelists to give me, in terms of their conclusion and concluding remarks, just an idea of what would be the main issue you feel like your government should invest in to address some of these vulnerabilities, discrimination that you are facing within your specific context. As we note, the theme for CSW this year is the investment and the priority of this acceleration and investment. And so in terms of investment from the government within your context, what is the most important areas for your government to invest in within your context of work and within the context of where you are based within your work? And I want to then, maybe if we could start again with Ida, because we saw you much earlier on, and maybe we can bring you back in, and you can please unmute yourself and put on your camera if you can, and I'll do the same question for each panelist. But Ida, if you could maybe give us that concluding remark on what is the most important area for your government to invest in within the context that you're working within.
Well, for me, in Trinidad and Tobago, I would like to see domestic workers recognized as workers, because this year is 50 years. We will have 50 years. We'll be celebrating 50 years as a union, a trade union, although we don't have the clout as other unions because of the membership that we represent. I would like to see that the government recognize domestic as workers, amend the Industrial Relations Act just to include domestic as workers so they can get decent work. They can share in what other workers everywhere in Trinidad and Tobago is getting. We could also be able to now help domestic workers better, with the grievances. Domestic workers might now be able to come out and be proud to say, I am a domestic worker, because that is one of the problems we have. Domestic workers don't like to say they are domestic worker. I have a sister who worked 30-something years as a domestic worker. And she is so proud to talk about domestic work, how she would clean the person that she working with home and things like that, how she had the house. But to tell you the truth, when you go by her, she had a lot of things in the sink dirty, and her house wasn't clean at all. So she was doing all this for the employer and leaving all her work undone, because when she reached home in the afternoon, she tired. So you see, in this way now, when that happens, they become workers. We can now organize them into the union to get, we want status, recognized majority status, to be able to bring collective bargaining, do collective bargaining, have a collective agreement that says employer must follow this and that for the domestic workers. Bring them up in line as all other workers, as my mother would say, because she, Clotilde Walker, started this union 50 years ago. Clotilde Walker, she's deceased now. So that is what we want. We also want to see that social security system is a good system, but we want to see that domestic workers have the same rights like all other women who they say are unemployed, even though they're working, doing on-wage work in the home and things like that. Imagine your husband had to be in jail in order for you to get some assistance with the government. And that is saying a lot about the type of government we have. So we want to see, and the kind of, you have to be friends with somebody to get these privilege, you have to see, because it turned out to be a privilege to get a food stamp, to get help from the Social Security, to get some, well, I will call it a salary for all the work that you're doing in this country and building the country, to be able to live a decent life. And still, you wouldn't live a decent life. You will have to pull your act together to ensure that, you will still have to be budgeting and trying to even have a little garden around your house of food, where you could plant some food and things like that. Uh, you know, so that you could live a decent life. That is what domestic workers want, to live a decent life. So sometimes, look, recently I spoke on it, not recently, a good few years ago when they had the COVID. And I said that these privileges only sent up given to the political parties, the people who follow them. And the minister was there listening, and she was upset because she said that wasn't true. But I'm on the ground. I'm hearing what people are saying. You know, if you don't know somebody, you get nothing. So that is why the domestic workers, we are stepping up on the social security and making ourselves visible now, stating that domestic workers and low-income workers, because they all get the minimum wage, which cannot take care of them, they're supposed to be getting social security in our country. So that is our intentions, and we will continue the fight to fight for domestic workers. And fighting for the domestic workers is like fighting for the families too, because when sometimes they come to meeting, they will have to come a little children, things like that. And we tell them, don't worry about that, because that is how I grew up, going as a little child with my mother. And that is why I'm so involved today in the Domestic Workers Union. Thank you.
Thank you so much, Ida. Thank you for that. I'm going to hand over straight to Sis Collie now to also just please give us an overview of what the most important areas are in terms of sex workers for the government to invest in within the context that you are working.
Thank you so much, Chrissy, and thanks to all the panelists. I could see that the issues that are presented today, there's this interlink of the challenges that we're facing, because being sex workers, regardless of who you are, we're still human beings, which is one of the things that we're trying to push, that people look at sex workers as human beings, not as sex work, because that it comes with the discrimination. It is attached with it discrimination and stigma that is perpetrated by the current punitive laws that is in the country. So it is important that government, and we have been saying this, as I stated earlier, that the call for decriminalization, it did not just start yesterday or today. It's been years, and I'm wondering and I'm asking myself, is our government a human being? Is our government a person that who do understand that when someone is hurt, it's painful. When someone is being marginalized, it's painful. When someone is being is vulnerable, people are easily to take advantage. And why would we have such laws in our countries that marginalizes women, especially in South Africa, that is a democratic country, that the democracy we fought for, our parents, our cousins back then. So we have been calling our government, because what is happening into sex workers, it is so sad. I'll make an example of the serial killer guy that was killed, 60 sex workers. We don't know if there's still some that he has not pointed it out, but for the fact, it is quite heartening to hear that he's now being taken for the psychiatrically care. He had to also have access to social worker. And our question as marginalized communities is, what about the sex work, the children of the sex workers that were killed? Did any government to actually show their remorse to come and visit them? Is there anything that has been done around the parents, receiving the body of a decomposed of a child that you can't even recognize? That's how our government is failing. In the healthy care facilities, those are big challenges, which as an organization, we in the process of linkages, we try to take to take in, sometimes welcome unsensitized service providers, who then makes the experience a unpleasant one, and therefore that it's also hindering sex workers from accessing the services. We cannot continue to depend on donor. Yes, donors are there, but they come and go. It is important that our government facilities are accessible, so that whoever wants to need to have access to healthy facilities is accessing those facilities without the fear of stigma, Because one of the reasons that I became part of the Sisonke movement and the founding member, it is because I was discriminated at the clinic, at the health facility. And I was not sick, but I just went because I needed it to service myself. I just feel that I need to go to hospital. I had this engagement with the nurse. I was assisted. The next time I go back, because of the address of where I was staying as a sex worker and the health facility, it was around near the CPD. So they knew all the brothels in Johannesburg. So those kind of things would make people not to want to access the services. As I said that earlier, our government is one part of government is providing condoms, one part of government is taking condoms. But you find out the Department of Health has not, they don't say nothing. To me, that is a concern because I would love to invest into something that will have a greater impact. I cannot invest into something that it has a negative impact. So therefore, they are investing into nothing because sex workers, when they are being detained, they don't have even access to medication, whether it's a high blood medication or it's a PrEP, you know, they don't have that kind of access. And these things are still happening. The banning of condoms are still happening. The taking a condoms of use as evidence when you get to the police station, it is something else. It's no longer the evidence, and then you are told that the public nuisance. We are tired of living in that kind of a condition because we are citizens of the country. So therefore, we should be having access to all those facilities. I call for our government to speed up the process of decriminalization because it is not about people are doing business. It is about the rights. So therefore, we are being denied those rights. To advocate for such a long time, I think it's more than 25 years now. I would need to go back to calculations and just think Guti where so that when I give this kind of information, I give the correct one. But I know that it's now more than 25 years. Our government, all the concerns, we've knocking all doors. Wanting to asking for assistance and support in this regard, but it feels like the advocacy work and effort that we put forward, it just fell into deaf ears. And I so wish that they need also to be in sex workers' shoes so that they can feel and understand. You cannot be an activist. You cannot be in the position of government with your own agenda and forget about the people on the ground that you are representing. Oh.
Thank you so much, Siskoli, for that. Thank you so much for your showing the opportunities of investment from the government's perspective. Thank you for that. I'll hand over now to Mariam. If you could also just speak to us. I know in your presentation you had some calls that you had made, and if you would like to just say to us in terms of your current context, what some of the most important areas are in terms of investment within your context. Yeah.
Yes. Actually, when Collie spoke, she just made me realize that the most important thing in our context is basically to change the Palestinian government. They've been there since 16 years. No democratic elections have been take place since the blockade began on Gaza 16 years ago. And I think, to be honest, the only way to do positive change in our context is basically to change the leaders, because it seems that they are failing us over and over again. So basically, the most important demand would be a Palestinian government that is able to hold Israel accountable for all its violations. We need also to invest more on how to present our image as Palestinians on the international level. This is very important. The Palestinian government also must develop strategies in order to improve its health system, access to employment and social funds, because we like this in Palestine. There's no social security also, as Ida mentioned, for domestic workers, but this is actually for all the Palestinian people. No adequate healthcare system, no adequate strategies for employment, nothing. So the situation is just keeping people go from poor to poorer. The Palestinian government also must improve its advocacy steps on the international level and hold different initiatives focusing on the fulfillment of the right of Palestinian people and women in particular. This is the closing that I want to give. Thank you.
Thank you very much, Mariam. I think that was very powerful. Thank you so much for sharing that with us. And then last but not least, I would like to hand over to Koliso just to indicate to us in terms of all of the barriers that you indicated earlier, what are some of the most important areas you think the South African government could invest within this context?
Thanks, Chrissy. I'll try to be really quick so that we also have maybe a time for like a question or two. I think for South Africans context, we actually have a very interesting time ahead for us, considering that we have the NHI, the National Health Insurance Bill, coming up soon. And in it, basically the general idea is to kind of combine our public and private healthcare industries together. Not a lot has been kind of formalized in terms of how that will precisely look like. So I think that gives us a really good opportunity to kind of start having conversations in our own circles and within our own communities about what priorities we want to set for our healthcare industry, and what we want to campaign for. A lot of things that are really coming up are, for instance, really focusing on what will become big is the procurement process, getting involved in kind of what access to healthcare will look like for us, what services we want, what type of products are available to us, like really getting into the nitty gritty of what it means to have the right to choice and what that choice looks like. And so in the next few months or years, or however long the NHA is going to kind of start taking its form, this is a really good opportunity for us to kind of invest in the process of getting healthcare providers, civil society, and all these organizations together to start having conversations about what our healthcare system looks like now and what we want to change in the new one that is going to kind of be introduced. But overall, across the board, I think we can all agree one of the really great foundations that we are always looking for is we need our states, not just the South African government, but I think it applies nationally and internationally, is a prioritization on innovation and development. We need a priority on training and a priority on getting more trainers in our facilities. And that comes with investing into our healthcare industries. Another big thing that's come across is kind of focusing more on data collection, kind of making sure that we put emphasis on recognizing the issues that women go through and recording these experiences and making sure that these experiences are reflected in the systems that we are putting together. And then broadly, we need to start providing for social assistance, like they've said, and recognizing unpaid care work across the board if we seek to give women more liberty and more freedom to kind of be able to move around in our society and access services. We need to kind of tighten our accountability systems as always. That's always a thing. And overall, I think, lastly, we really just need to prioritize creating a woman-centered approach, or be it a victim-centered approach or a person-centered approach, just an approach that focuses on the person accessing these services and tailoring these services to suit those needs. So that's kind of things that we're really looking towards the state and partners and everyone to kind of focus on and get involved in and champion going forward. And from there, I think that gives us a really good platform to build on. Thanks, Chrissy.
Thanks so much, Kuliso. We have maybe 2 to 3 minutes left. If there was anyone else who wanted to make a comment or ask a question, I've noted Charlene's comment about the most important areas for government, and that is how our participants, our panelists all kind of spoke to their different contexts. But if there was anyone else who would like to ask a question or make a comment at this point, if not, I'll just use my liberties as the facilitator just to also just kind of thank the panelists so much for their presentations today. I think it was really insightful. I think it was really powerful. I think there were several takeaways from your concluding remarks about what areas are needed in terms of investment. And I think as we started this session, it is amazing to see that even at the end, even though we are at different aspects in the world, in different contexts, in different time zones, our issues are all really interrelated. And I think even in your way forward and your areas needed for improvement and investment, all of them are aligned even within the different contexts. I think as we wrap up the session, the key takeaways for this is that one, women across the globe still remain the face of discrimination. And I think from Ida, Siskoli, Kuliso and Mariam, all of you are asking, one, for legal recognition. So for the government to really invest in legal recognition, not only with domestic workers, not only within the recognition and decriminalization of sex work, but the legal recognition of women and their vulnerabilities. But then once there is the legal recognition, for government and state actors to work together, because all of you spoke to the health sector, social security and labor, and then the police, which is safety and security within your context. And something that comes out from all of your presentations is that these state actors are not speaking to each other, they are not in alignment, and they are not working together. And so all of you are essentially saying, one, we need the law that legally protects and recognizes these groups as vulnerable, but then we need the state actors who are supposed to enforce these rights to speak to each other and to work together. Another thing that all of you have spoken to is the training, education, and sensitization of these state actors, because even where women of a particular group, class, race, or work sector come to these state actors, they are directly discriminated against because of stereotypes and stigmas which still exist in our society. And so it's that legal recognition, it's that sensitization, training, and awareness. And like you ended off now, Kuliso, at the end, about being innovative in how we ensure that all of these state actors, the policy and the reform that we then institute is really led by data and led by the lived reality of women who most need the access to these services. So I want to thank not only our panelists today for bringing really these insightful experiences and contexts to us, but also to all of you who have joined and who have taken time out to join this session with us. We will be putting this information and our session today, it will be recorded and we will be posting it through our social media pages. Our information is in the chat box. Please feel free to take that and follow us. And we look forward to collaborating and working with everyone as we move forward through this investment. Thank you so much to everyone, and enjoy the rest of your evening or day where you are placed. Thank you so much.
Thank you also.